Hello, I'm Sean Park, and today we're going to talk about the genital warts. So, genital warts, what is it? It's a small bump formed in your penis. So it's usually formed around your penile skin or the skins around it, like the pubis or the scrotum. Sometimes, time to time, it happens. Most cases is caused by the human papillomavirus, as all we know as a HPV. Just the same virus which can cause women cervix cancer. So nowadays we have a vaccination toward HPV, but still, even though you get vaccinated, as you know, you can still get infected. And once it gets infected, it will form a wart in your penile skin. That's what happens. The HPV themselves have no means of vector, so they cannot make another lesion in your penile skin unless you move it from the original lesion. So if you scratch it, it can come from point A to the point B. Or if you do the shaving, it can also go from A to the B. Or if you have an intercourse also, it can spread like that. Lesions smaller than the 3 millimeters has a good chance of the just remission. In 6 months, they sometimes just go away without treatment. But lesions bigger than 3 millimeters, they do not go away by itself. And if the lesion becomes bigger than the 5 centimeters, like in diameter, there's a chance that it becomes a skin cancer as well. So you need to get it treated if the lesion is bigger than 3 millimeters, and if it doesn't go away, you need a treatment. Treatment is pretty simple. It's like treating a mole. So we can either fulgurate it, or we can cut it out, or we can electrocauterize it, or sometimes we can freeze it to treat it. But in my hands, I prefer to do electrocauterization, which means inflicting a slight burn, like a first degree or light second degree burn to the skin, which will eliminate the virus and the lesion at the same time. Vaccination has been shown that it reducing the recurrence rate. The problem with the genital wart is because of this recurrence. So there's about 33% of the recurrence rate, even though we get it electrocauterized. So nowadays people are trying to make the men getting vaccination as well to get it prevented and not to spread it toward their partners. Getting it treated and then getting a vaccination is maybe a good way to prevent its recurrence. Overall, genital warts itself doesn't mean a lot of things to men. It's just be some uncomfortness or the aesthetic problem. Time to time, it can spread the other lesions, then it can make a problem. But in a nutshell, it affects women more. So it can make women have a cervical cancer or the more serious diseases. So getting it treated is very important for your partner and for your health as well. So visual inspection of the skin is the best way to prevent it. And every time you go to the bathroom or if you have a chance to inspect it, you'd better inspect it thoroughly to catch out the lesion in advance. So in summary, genital wart is not a big deal for men. If he can detect it in advance, in an early stage, treatment is not that difficult. Just cutting it out will do the job. So regular and quite thorough inspection of the penile skin can be best done by patient themselves, you yourself actually. So look into it, and if you have any thing grows there, if it's small, like smaller than the 3 millimeters, just wait a while. But if it's still there after 3 or 6 months later, then you'd better get a treatment, go see a doctor.